important simplified. So we are going to study about a very important topic in community medicine, which is healthcare system in India. So moving on to healthcare system in India, first we have the PHC. PHC is always a frequently asked question also. What is PHC? Primary. So first we'll be studying about the structure of healthcare system. Healthcare system is basically comprises of the primary level, the secondary level, as well as the tertiary level. So primary level is the basic level which is available to everyone, okay, and secondary level requires all these specialized treatments, and the tertiary level consists of high-end hospitals. So what is primary level? It's the basic one which is available to everyone. It's available to everyone. And what is secondary level? Comprises of specialized treatments, any specialized treatments. And tertiary level comprises of high-end hospitals. Now, how is the approach to healthcare? So approach to healthcare is basically comprises of 4 aspects. So approach to healthcare comprises of 4 aspects. Number 1 is health promotion. And number 2 is preventive healthcare services like vaccine. So health promotion and preventive healthcare services such as vaccines. Preventive healthcare services such as vaccines. And number 3 comprises of curative services. So what are the curative services we have? Like the anti-tubercular therapy. Example, the anti-tubercular therapy that we have for tuberculosis, the antiretroviral therapy that we have for HIV and all. The fourth one is disability limitation. Disability limitation and rehabilitative services. Rehabilitative services. So yeah, the approach of healthcare, especially primary healthcare, is these 4 aspects: health promotion and preventive healthcare services like vaccines, curative services like anti-tubercular therapy, antiretroviral therapy, and disability limitation and rehabilitation. So there are certain elements of primary healthcare. So what are these elements of primary healthcare? So these elements of primary healthcare, the mnemonic itself is going to be elements. So the mnemonic itself is elements. So what is this elements? So E stands for education. The first one is education. L stands for locally endemic disease prevention. Locally endemic disease prevention. And then the next E stands for essential drugs. Essential drugs. And M stands for maternal and child health care. Maternal and child health, along with that family planning. Family planning. And E stands for expanded immunization program. N stands for expanded immunization program is actually against the major infectious diseases. Example is the Mission Indradhanush. We have Mission Indradhanush for expanded immunization program. Mission Indradhanush Intensified Mission Indradhanush. Just remember Mission Indradhanush. N stands for nutrition supply. Nutrition supply. T stands for treatment of common diseases. S stands for safe water and sanitation. So yeah, what are the elements of PHC? E stands for education. L stands for locally endemic disease prevention. Another E stands for essential drugs, providing essential drugs. M stands for maternal and child health along with family planning. E stands for expanded immunization program. Example is Mission Indradhanush. N stands for nutrition supply. T stands for treatment of common diseases, and S stands for a safe water as well as safe sanitation. So these are the elements of primary healthcare. There are certain principles of primary healthcare also. Now let's move on to the principles. So what are the principles of primary healthcare? Okay, this is also very important. So the principles of primary healthcare are, there are totally 4 pillars. 4 pillars of our nation. What are the 4 pillars or principles of primary healthcare? First pillar is equitable distribution. Equitable distribution, that is, the healthcare should be equally distributed to everyone, to all, even the rural areas, the urban areas. So there must be an equitable distribution. The second pillar is, this is the first pillar. Second pillar is community participation. Very important, right? So for any healthcare program to be operated, the community participation is very essential. So community participation. And the next pillar stands for intersectoral coordination. There must be intersectoral coordination. And then the last pillar is appropriate technology. Appropriate technology. So these are the 4 pillars of primary healthcare. First pillar is equitable distribution. Second pillar is community participation. Third pillar is intersectoral coordination, and the last pillar is appropriate technology. Now what do you mean by each of these? Let me explain you. What is equitable distribution? Equitable distribution means the healthcare given to those who needs it more. Like there are a lot of middle class, so the lower socio-economic class, or equitable distribution means severe patients, okay, should be treated first. That is an example of equitable distribution. That is, healthcare should be given to those who need it most as per the health need requirement. Like for example, there is an endemic population, so the vaccines first to that endemic population must be given first, right? That is equitable. Those who need the most, that is where the healthcare must be first provided. That is equitable distribution. Moving on to community participation. Community participation is one of the strongest pillar. It's a very strongest pillar for any kind of primary healthcare activities to be implemented. It is this very strongest pillar because it involves the community. Example is ASHA and all. Then third is intersectoral coordination. So what do you mean by intersectoral coordination? That means different departments will be working together for the healthcare system. For example, there is a TB case, the microbiology department, the pulmonary medicine department, as well as the community medicine department for notifying the cases. So there are multiple departments working together, right, for the healthcare system. That is intersectoral coordination. Then moving on to Ministry of Education. Example for intersectoral coordination is Ministry of Education, Ministry of Health and Family Welfare. So Ministry of Health and Family Welfare, like Poshan Abhiyan, Poshan Mission, all these. Anemia Mukt Bharat, ICDS, Integrated Child Development Services, all these are intersectoral coordination. Appropriate technology like the NICUST app for leprosy. For leprosy, it is the NICUST app for leprosy is an example for technology, and Nikshay app for TB is another example for appropriate technology. Now this is all about the PHC. So this is all about the PHC. PHC, we saw the primary level, secondary level, tertiary level of healthcare. How is the approach of healthcare? What are the four different approaches to healthcare? And we saw what are the elements of PHC, and then we saw the principles, 4 pillars of PHC: equitable distribution, community participation, intersectoral coordination, and appropriate technology. Now moving on to the healthcare system in India. That is also important. So how is the healthcare system in India? So we know in India there are 28 states and there are around 8 union territories. We have 750 districts, and each district there are subdivisions, and every subdivision you have a tahsil and blocks. So blocks basically can be either urban or rural blocks. So in urban you have towns, municipal boards or corporation. In a town, how much population? Town will consist of 5,000 to 10,000 population. A board consists of 10,000 to 2 lakh population. A corporation is one that consists of more than 2 lakh population. And then you have a metropolitan city, more than 1 crore. Now you need to know the rural or the Panchayat Raj system. So the Panchayat Raj system consists of village, and then a panchayat, and then panchayat samiti. So what is panchayat samiti? Panchayat samiti consists of 100 villages. So 100 villages combined is a panchayat samiti, and this panchayat samiti is a block level. This is a block level, guys. And then after panchayat samiti you have the zilla parishad. Zilla parishad is nothing but the district level. Zilla parishad is the district level. And after that, under panchayat itself you have 2 things: gram sabha and gram panchayat. So gram panchayat consists of around 15 to 30 villages. 15 to 30 villages. One village consists of around how much population? One village consists of around 1,000 population. And remember, 100 villages together is going to be block level, that is 1 lakh population. So again, village, and then all villages you have panchayat. In panchayat will be gram sabha and gram panchayat. Gram panchayat consists of 15 to 30 villages, and after this panchayat you have panchayat samiti. Panchayat samiti consists of 100 villages, that is block level. And above the panchayat samiti you have zilla parishad, which is your district level. So this is the panchayat raj system. So coming to the rural healthcare system, the rural sector structure is going to be given, very famous. The rural sector structure is given by NRHM. That is, NRHM stands for National Rural Health Mission. So in National Rural Health Mission, under National Rural Health Mission, the village consists of around 1,000 population. And for each village 1000 population there is a particular ASHA worker. In case of subcenter consists of around 3000 to 5000 population, and around 3000 to 5000 population, and the workers are here going to be you are going to have a multi-purpose worker in subcenter. And then under PHC, primary health care, it consists of around 20,000 to around 30,000 population, and there are going to be 3 medical officers. There are going to be 3 medical officers. One medical officer is in charge, one medical officer in Ayush, one medical officer in dental, and auxiliary nurse midwife. Whereas next is your community health center, CHC. Community health center consists of around 80,000 to around 1 lakh population. There are in community health center there will be many specialists such as in medicine, surgery, OBG, pediatrician, anesthesiologist, ophthalmologist. So all specialists will be coming under community health center. And then the last one is your district hospital. So under district hospital there are going to be clinical specialties plus clinical specialties plus specialized laboratory staff, nurses, auxiliary nurse midwife, pharmacists. A very important all blood bank consisting of the program manager. All of them will be coming under district hospital. Okay, all under district hospital program manager. So National Rural Health Mission, there is village 1000 population ASHA, subcenter 3000 to 5000 population multipurpose worker, PHCs 20,000 to 30,000 population where 3 medical officers are appointed, community health center 8,000 population specialists, district hospital blood bank program manager. Now very commonly asked question, next question is ASHA worker. So next question, is ASHA worker. So what is the full form of ASHA? Accredited Social Health Activist. Accredited Social Health Activist. So who is ASHA? ASHA is basically a 25 to 45 year old female. 25 to 45 year old female. What is the education criteria? The education criteria should be 10th pass. So ASHA is a 25 to 45 year old female. The education criteria is 10th pass. She is generally married in the village and a permanent resident. So married in the village and is a permanent resident in the village. Permanent resident in the village. At least this female should have at least 1 child and not more than 2 children. Needs to undergo induction training. She needs to undergo a training known as induction training. So what do you mean by this induction training? This induction training stands for initially 7 days plus 4 days for 4 sessions. That is totally around 23 days of training. So that is induction training. Initially 7 days plus 4 days for 4 sessions, 23 days. And now coming to the functions. What are the functions of an ASHA worker? So the functions are, first function is home visits. So ASHA workers will go and visit the homes, and ASHA is a depot holder for, very important, ASHA is a depot holder for ORS, antibiotics, iron folic acid supplements, family planning methods. Very important. So ASHA is a depot holder for ORS, antibiotics, iron folic acid supplements, family planning methods. And every ASHA worker must maintain a death as well as a birth record. And she will be counseling the women on reproductive child health care. So she will also counsel women on reproductive and child health care. And sanitation campaigns are also conducted by ASHA workers. Sanitation campaigns. Now, the next function is she visit the health facility. So not only home visits but also the health facility will be visited by the ASHA workers. And importance of VHSN, that is Village Health Sanitation and Nutrition Committee, holds Mahila Arogya Samiti meetings. All this. So this is all the functions of an ASHA worker. Now let's move on to multi-purpose worker. Multi-purpose workers. So multi-purpose workers are generally male. And first, in vector-borne diseases like insecticide sprays, malarial slides, fever treatment, etc. is taken care by multi-purpose workers. So all vector-borne diseases where we use insecticide sprays, we use malaria slides, fever treatment, all is taken care by multi-purpose worker. Now multi-purpose workers are responsible for quality of water also, for the quality. So multi-purpose workers are responsible for the quality of water, especially chlorination of wells and safe water supply. Multipurpose workers are responsible for record keeping or register maintenance, OPD or survey maintenance of the subcenter. So OPD survey as well as maintenance of the subcenter, all this will be taken care by multipurpose worker, male. A multipurpose worker, female. So a multipurpose worker, female, will be taking care of antenatal care, postnatal care, immunization, growth and development, family planning methods, maintains registers for eligible couples or family planning, and does OBD survey. All these will be taken care by multipurpose worker, female. And all these multipurpose workers must be having around 1 year training. Around 1 year of training. So multipurpose, there is a multipurpose workers, they developed a committee known as Carter Singh committee. You don't have to remember, just remember the activities of ASHA alone: holding meetings, mass meetings, that is holding mass meetings, maintaining record, home visits, attending the UHND, and visits to the healthy facility. All these are the activities of ASHA as we discussed. So medical officers, their duties to be in OPDs, There will be a team leader. They do small surgeries, and they give medical as well as drug system. Okay, as we studied the National Rural Health Mission, similarly for urban areas you have National Urban Health Mission. So under National Urban Health Mission, this is under the urban healthcare sector. So you have a urban ASHA for a population of around 1000 to 2500. You have ANM centers, auxiliary nurse midwife ANM centers for 10,000 population. Urban public health center for 50,000 population. Urban community health center for around 2 lakh to 2,50,000. District hospital for around 5 lakh population. So remember, so urban health mission along with national rural health mission, both national urban health mission and national rural health mission is comprises of national health mission. Basically, national health mission means national urban health mission plus national rural health mission. Now let me talk about ICDS scheme. So let me talk about this ICDS scheme. So ICDS is basically stands for what? Integrated Child Development Services. Okay, so ICDS stands for Integrated Child Development Services. It was launched in 1975 under the Ministry of Women and Child Development. So it was launched in 1975 under the Ministry of Women and Child Development. Okay, Ministry of Women and Child Development. So under Integrated Child Development Services, you have the Anganwadi. You have an Anganwadi supervisor as well as a Child Development Project Officer, CDPO, Child Development Project Officer also. There are various levels. Similarly, you can split it into rural, urban. Okay, under rural you have village, subcenter, PHCs, community health center and district hospital. In urban you have an urban ASHA, ANM centers, urban primary health care center and urban community health care center. All of these you have similarly. The workers will be Anganwadi supervisor as well as your child development project officer. And the role in the system is going to be lowest system, workforce, pillars of India and the block level hospital and administrative unit. As I already told you, what are the 4 pillars that we studied in healthcare system? So the 4 pillars are equitable distribution, community participation, intersectoral coordination and appropriate technology. Okay, so yeah, equitable distribution, community participation, intersectoral coordination and appropriate technology. So always 1000 population, you have a village where you have ASHA workers, Anganwadi workers, village health guide and trained die. And then these around 5 to 6 villages together is going to be a sub-center where you have health wellness center, and 30 to 40 villages together you have a primary health center, and 100 villages together is your community health center. So under community participation you have Rogi Kalyan Samiti, Mahila Arogya Samiti. These two are okay. So favorite question, write a short note on National Health Mission. So first you have to say that the National Rural Health Mission was in the year 12th April of 2005, and National Urban Health Mission was around the 1st May 2013. So first there are 5 components of National Health Mission. So what are the 5 components? First is to communitize. Communitize. To communitize is the first component. Then the second component is improved management through capacity. So improved management through capacity is your second component. Capacity is your second component. The next component is to monitor progress. To monitor progress. The fourth component is innovations in human resource management. Innovation in human resource management. Innovation in human resource management. And the next one is flexible financing. Flexible financing. So National Health Mission comprises of 5 components. The first one is to monitor progress, then to communitize, and then improved management through capacity, flexible financing, and innovation in human resource management. So these are the 5 important components in National Health Mission. So how is your approach going to be towards National Health Mission? So National Health Mission, there are 4 approaches: efficiency, equality, effectivity, and equity. So the 4 E's in National Health Mission. First one is efficiency. First E is efficiency. And then second E is your equality. The third rule is effectivity. How effective is your National Health Mission programs? And then your equity. So these efficiency, equality, effectiveness, equity is important. Equality is to the whole community, you should get all medications and everything. Equity is as per the requirement. Efficiency is good care. Increased effectivity is increased affordability and acceptability, leading to increased utilization. And then after this you have the Ayushman Bharat scheme. Ayushman Bharat scheme has 2 sectors: PM Jan Arogya Yojana. PM Jan Arogya Yojana is to provide health insurance, comprehensive primary health care, opening of health and wellness centers. So again revising, your Ayushman Bharat scheme has 2 sectors: Pradhan Mantri Jan Arogya Yojana. This Pradhan Mantri Jan Arogya Yojana is basically to provide health insurance. Whereas the second sector is comprehensive primary health care. This is all about Ayushman Bharat scheme. So I have covered in detail the healthcare delivery system in India. So this is all about your healthcare system in India. We studied about PHCs, the primary, secondary and tertiary levels, the approach to healthcare, the elements of PHC, the 4 pillars of PHC, and then the healthcare system in India, briefly about NRHM. Then we studied about ASHA workers, multiple purpose workers, what is National Health Mission, and the 5 components of National Health Mission, the 4 E's, and Ayushman Bharat system. To know more important questions in common and other subjects, please do like, subscribe and share this channel. Thank you.